It is my pleasure to welcome Perri Kirshenblatt.
Good evening, everyone, and welcome to Path to Parenthood, Fertility, Surrogacy, and everything in between. My name is Perri Kirshenblatt, and I'm the 2021 UJA Women's Philanthropy Chair alongside my Vice Chair, Sarah Gottlieb. Before we begin our program, I would like to extend our deepest gratitude to this evening's sponsor, Create Fertility Center. We are so appreciative of your support and generosity. 2020 was an unexpected year for Toronto's Jewish community. There were many lows, many highs, and a lot of uncertainty. What is certain, though, is the big way in which our community stepped up. When UJA asked for help in meeting the growing needs of the vulnerable, the community's quick answer was absolutely remarkable. From the 2,000 plus volunteers to the 13,000 plus donors, UJA's emergency campaign literally saved lives. We have officially reached our $85 million target, an outstanding accomplishment, which will help us continue to support those most in need as this pandemic endures. One of the most upsetting effects of the COVID-19 crisis is the food insecurity felt by so many in our community. Even before the pandemic, thousands were struggling to put food on their tables. Then with job loss came financial hardship for some families who never needed help before. As well, seniors, including some Holocaust survivors and the immunocompromised, have not always been able to safely leave the house for groceries. UJA has made tremendous progress over the past 11 months with food programs, including sending out over 50,000 kosher Meals on Wheels, delivering food share kits, delivering groceries, and more. But the needs continue, especially with Passover coming up next month. As we prepare for the possibility of another Passover and lockdown, UJA's Global Seder has never been more important. Over 1 million more Canadians are struggling to put food on their tables this year, which includes many in our local Jewish community. As well, Jewish communities overseas are battling with food insecurity more than ever. Your support in helping those who need it most, especially when it comes to putting food on the table, is so greatly appreciated. For more information on Global Seder, please visit globalseder.com. I am now pleased to introduce our moderator for the evening, a fertility coach and pregnancy loss doula, Alexandra Sipos-Kocsis. Over to you, Alex.
Thank you, Perri, for that wonderful introduction. I'm honored to be tonight's moderator and am very excited for our upcoming discussion with our panel. This is exactly the kind of conversation that I wish existed 10 years ago when I started out on my own fertility journey. If you have any questions for our speakers during the conversation, please feel free to anonymously use the Q&A feature. We will try to get to as many questions as we can. The path to parenthood is so universal and yet so unique. Some of us go through IVF or surrogacy, deal with multiple losses, or go through the process of adoption. You could be in a relationship or single, in a same-sex couple, trying for your first or your third. There is no singular way to become a parent or grow your family, and we hope that this webinar helps you wherever you are on this journey. There is a lot of information and a lot of questions to be answered when it comes to fertility, which is why UJA's Women's Philanthropy and UJA's Healthcare Division felt it was so important to host this webinar, and we hope it's the first of many. At this time, I would also like to highlight one of the many agencies UJA supports, Jewish Free Loan, a not-for-profit organization that offers easy to apply for fertility and adoption support. And for more information, you can visit jewishfreeloan.ca. Okay, so let's get into it. I'm honored to introduce our panelists for tonight. Dr. Cliff Librach is the founder and director of Create Fertility Center and Create Cord Blood Bank. He is also professor in the development of obstetrics and gynecology at the University of Toronto. Meredith Mednick is a senior client relationship manager at Scotiabank. And finally, Amira Posner is a clinical social worker and therapist. Thank you all so much for joining us for this important webinar. So my first question is going to be for Dr. Librach. When would you recommend that somebody gets referred to a fertility clinic? And what sort of tests can somebody expect on their first visit?
So that's a great question. So infertility is defined as 1 year of unprotected intercourse. And overall, about 1 in 6 or about 15% of couples will fit into this category. Therefore, most people really know someone who's suffered from this horrible situation of being infertile. But there's definitely situations where you should seek help sooner. For example, the female partner's age is a major factor that influences fertility. So if you're over 35 and your risk really is higher than 15%, and you really shouldn't wait an entire year before seeking help. Other situations where you should seek earlier include, but are not limited to, if you have very infrequent, irregular periods, if you had very painful periods or pain with intercourse would be other examples. If a male partner has like problems with testicular surgery in the past or cancer in the testicle, or if he's had previously abnormal semen analyses. If he has had difficulty conceiving maybe with another partner in the past would be a reason to seek help earlier. Obviously, if you've had chemotherapy or radiation to the ovaries or testes areas, that would be very important. And if we talk about your family, if you have a close family member who's been diagnosed with endometriosis, for example, or if you've had, if your mother had an early menopause in her like 30s or early 40s, and if your parents had infertility as well, those would be other reasons why you may seek help early. The last one I'm going to mention is if you or your mother had 2 or more miscarriages, you should also seek help right away because we define that as recurrent pregnancy losses rather than infertility.
Great. And what can somebody expect coming to you for the first time? What sort of tests can a couple expect?
Great. So, in terms of testing, we need to do tests on both the female and the male partner. This is, you're both in this together, and it's a unique area of medicine because, most areas of medicine like diabetes, you're treating one person, but here we have to deal with both people, and it's like a puzzle. We have to sort out what the problem is, and there can be problems with either one of the partners or even both. And about 50% is due to a male factor. So it's really important the male is also included in all of this. So we begin by taking like a detailed medical history on both partners and a physical examination. And the tests we perform are blood testing on the female partner aimed at looking at her ovulatory function to see if she's ovulating, as well as an AMH test, which is a new very important test called anti-Mullerian hormone, and anyone who's been through fertility investigations will know what that is. But it's to look at the ovarian reserve, we call it. And then we check hormones that could affect ovulation. And for the male, we also check hormones that are related to sperm production. We then check the uterus and the ovaries with a pelvic ultrasound, usually in a 3D way. And we also check the fallopian tubes with a dye test by using ultrasound. And of course, we need to check the sperm, and we can do a quantitative test like a semen analysis. We can also do a qualitative test called sperm DNA fragmentation testing. And sometimes we perform a scrotal ultrasound on the man to look for varicose veins called a varicocele. And in some cases, surgery is needed for the female to check like the uterine cavity, which is called a hysteroscopy. And for the pelvis, it's called a laparoscopy. So these are some of the things that we do to look into where the problem lies.
Thank you for that introduction and our first question. My next question is for Meredith. So how much can fertility treatment actually cost?
That's a really great question. And it really depends. I realize that's not kind of the answer that somebody wants, but it really depends on treatments. As Dr. Librach mentioned, there are so many different options and tests and reasons and whatnot available that obviously the reasons aren't available, but reasons can be had. And each clinic, protocol, procedure, it's different depending on so many different factors. So these are very generalized figures, and they may not be your specific situation. Testing to determine what the issue is could be covered by OHIP, or could be upwards of $1,000 depending. When my husband and I were going through treatments, we had to get a genetic screening from both of us, and that was something that I believe cost around $1,000 in addition to all the other tests that we had to have. And then each individual procedure has different kinds of costs associated with it. For an IUI, which is intrauterine insemination, OHIP will generally cover the cost of cycle monitoring, but the cost associated with sperm washing isn't included. So that's about $500 per cycle. Medication for all of these procedures is never covered, and that could be around $1,000 per cycle, or it could be $6,000 per cycle. It varies so much. For IVF, which is in vitro fertilization, a non-funded cycle will cost around $20,000. And then on top of that, you have storage fees for your embryos, genetic testing fees. There's so many different fees that can be associated with this that you just never know. And then also when you get down the line, surrogacy is also another option that has fees associated with it. The actual cost of the
I think Meredith has frozen. So Amira, do you think you would like to step in?
Sure. Just in terms of speaking to the emotional aspects.
That would be great. Thank you.
Yeah, so this journey can be really emotional, heart-wrenching, and anyone who's gone through it or who's on it just, it's really a difficult time to go through. So the work I do is helping individuals and couples who are struggling with infertility from an emotional perspective, and helping them, get the strength to go through treatment or to look at their situation differently. And yeah, it's I love the work. It's really rewarding. And
That's wonderful. Thank you. I think Meredith's back. If you wanted to continue, or if Alex had another question.
Sure, Meredith, did you want to finish up your thought? You're back.
Sure. I think probably I started freezing when I started talking about surrogacy.
Yes.
Yeah. So what I was saying was that you can't pay a surrogate in Canada for their services. What you can pay for is for their fees associated with fertility treatments, for their fees associated with being pregnant, and for any medical appointments, transportation to from. Perhaps they need extra food, perhaps they need extra clothing, that kind of thing is permitted, but surrogacy in itself is not a paid for service in Canada. But if you go the surrogacy route, that can go, upwards of $60,000 when you factor in all the costs. So really, costs are super varied depending on where you start, what you need, your particular situation. So my original point about that question being so varied and wide really stands.
Yeah, that's really helpful, I think, for somebody starting out to even just be aware that there are these amount of costs, and we'll talk about some solutions to those numbers later. Amira, I'd love to ask you, what are some tools you can offer to help deal with the loss and disappointment somebody might feel when, they first realize that this is not going to be as easy as they thought?
Yeah, well, it's definitely a loss, because that's not how they thought they would be building their family. So essentially they're giving something up. And when they give something up, that's a loss. So it's trying to help them create room for a new vision to come forth whether that's going through an initial treatment or tests, or just helping them create, I guess, more flexible thinking, helping them to bring acceptance to what they're experiencing. It can be so difficult to go through, and when we're struggling, we clench up and we don't want to feel this way. We don't want to be going through this. And so just allowing them to bring acceptance to what's happening, and mindfulness can be really helpful.
Is there advice you would, I suppose, give to somebody at the beginning of their journey, sort of starting out before they've gone, gone into treatments? Sort of perhaps a way of looking at things, or?
Yeah, I think we often describe this as a journey, right? And it's got a beginning and a middle and an end. And we don't know how long we're going to be on it. And we don't know a lot about what's going to happen in life. So it's like a microcosm for that. And you can use it as a time to learn about yourself. It's easier to say, coming from the other side, but it's not the worst thing in the world. And it can take you places that you'll be surprised where you end up, right?
Yeah, I love that perspective. That's definitely a helpful way to look at things, for sure.
Yeah.
So Dr. Librach, back to you. I'm wondering if you can speak a little bit about third-party reproduction options. I think often IUI, IVF are perhaps more common. I think perhaps third-party reproduction options are less known, and maybe you could speak a little bit about that process.
Sure. So we have one of the largest egg donor and surrogacy programs in Canada. So we do a lot of third party in our clinic, and we actually have 13 nurses dedicated to that program in our clinic. So we do this every day. It's a very common treatment for us. And there are so many different treatments we can do in the third party realm. So first, just talking about the first part is really donor gametes, and that means having a donor sperm. Donor sperm can be used to help single women who don't have a partner and would like to have a child before, when they're getting older and may not be able to have children later on. Also, same-sex female couples or heterosexual couples, when there's no sperm present or very little sperm, would also be people that would use a donor sperm. Now, when we go on to donor eggs, that can be used for women who are born, say, for example, without eggs, or who lose their eggs later in life for several reasons. And also, they may have just poor egg quality, or have even entered menopause early. You can go into menopause sometimes even in your teenage or 20s or 30s before you even thought about having children. Or you can have women that have met someone later in life after they already went into their natural menopause, and they can use a donor egg too. And there really isn't theoretically any limit how old you can be to use a donor egg, because it really doesn't, it depends on the age of the egg, not on the age of the person. So those are, we limit to a certain age because of the risk of pregnancy in an older woman, but I think it's really important to note that it's not, dependent on the age of the woman. We also, of course, use donor eggs for same-sex male couples or even single men who would like to have children on their own. And the next area really is surrogacy. And we do quite a bit of surrogacy at our clinic. And it can help many different situations. Really, there's a myriad of situations, but I'll just give you some examples. Some women are born without having a uterus, and those women obviously have no other choice. They have ovaries, and they have a partner with sperm, then they can have a child through surrogacy. Those women who lose their uterus for either medical reasons like cancer, or even had to have their uterus removed for a medical emergency like a postpartum or afterbirth hemorrhage, which was life-threatening. Or maybe a woman would have a problem with their uterus that didn't develop properly or got scarred or has very thin lining. Women have medical conditions where pregnancy may be dangerous to them to carry the baby. And that there are so many different conditions. I could name over 100 different conditions now, and I see new ones all the time where it's just too dangerous for them to carry a baby, but they can have a surrogate carry for them. And then there's women who are actually on medications that are, life-saving but they can harm the baby. They're called teratogens. And those are women also that may require surrogacy to have children. Of course, again, the single men and the same-sex male couples don't have a uterus, obviously, so they would need a surrogate to have children. And then lastly, donor embryos is another area of third party, and that can be used in a number of situations, but that could be single women who have poor egg quality or maybe even in menopause, and they don't have a partner, so a donor embryo could be a great thing for them, and for couples that have both egg and sperm problems. So those are the areas where we use third-party reproduction.
Thank you. Amira, I'm wondering if you can speak to this next question that just came in. What factors should go into making a decision about who should use a surrogate? So maybe just to speak about the sort of emotional thought process that a couple would go through when deciding if surrogacy is for them.
Yeah, so one of the things that they'll have to go through is to meet with a counselor to talk about the process, just so that they can better understand what it is they're going to go through and actually think about what's going to happen in the future. And it's a loss again, right? Just the loss of not being able to carry the pregnancy on their own. So helping them again sort of work through that, but then open themselves to the beautiful option of having a carrier help them build their family.
And the follow-up question was asked how to choose the right surrogate. I'm wondering if you want to speak to that, or Dr. Librach or Meredith.
Yeah, I mean, it's a process, I guess, and there's different, there's agencies out there, and some of the clinics can support you through that process. Sometimes people will use somebody that they know, somebody in their family. And I've worked with couples, it's taken like a long time. Sometimes it doesn't take so long, but you want to get to know the person a little bit. And I mean, Dr. Librach can speak to, it's best if they've had a pregnancy.
Yeah. So yeah, all surrogates in our program anyway must have already had children. They have to be healthy. They have to have no trouble giving birth to a baby. And these are really incredible people that do this. I'm always amazed, and I call them heroes. They're amazing people that want to help someone else have a child. And as Meredith said, this is altruistic. They're not getting paid to do it. Obviously, we won't cost them money to do it. So there is reimbursement of costs. But we really do a very extensive screening of surrogates to make sure that they are a good candidate, because we have to make sure it's safe for them to do it and also safe for the baby that they'll be carrying. So it's really an amazing process of choosing a surrogate, and you have to really feel very comfortable with your surrogate, that you feel like you really can, you like working with her. She's someone you really get along well, and you feel like you can trust her to look after your baby and her body for 9 months. And we even do tests like a urine toxicology. We want to make sure that what she's telling us is true. We don't want her to be smoking cigarettes or taking drugs or any kind of thing that could cause harm to the baby. So it's really an incredible process and very detailed.
And is there an age limit on surrogates?
So we really would not recommend a surrogate over about 44, 45. Generally, they have to be younger. But it doesn't really matter if a surrogate's in her early 20s versus her 30s or early 40s. As long as they're healthy, there should be no problem with them to be able to carry a baby if they pass the screening.
Amazing. Meredith, I'm wondering if you can now speak a bit more to what funding is available in the community. So if you're on a fertility journey and these expenses are adding up, where can you turn?
Yeah.
What are your first steps?
So, I mean, I think first we are in Ontario. So it is important to recognize that Ontario is one of the only 5 provinces, I think it's 4 or 5, that does have funding fertility. And this funding is available regardless of gender, sexual orientation, sex, family status. And I think that's really important and really a nice benefit that we do have. So definitely one thing to consider is your clinic part of the funding? Does your clinic qualify to get funding? Because not all clinics in Ontario do get the funding. And so if you are going through this journey, it is important to make sure that you are choosing a clinic that does get funding and that has a good track record with the funding. This OHIP will cover 1 treatment cycle per patient for IVF. So, and what's really interesting is 1 treatment cycle is actually once all the embryos have been taken out and put back in, if that's what somebody wants. So that's called 1 at a time transfer of all embryos. I learned a new term today. Even though I went through it myself, I didn't really know what that term was. So I went through that. There's no limit to the amount of IUI cycles that are covered, but it is important to note that, the OHIP funding doesn't cover medication and it doesn't cover any of the sperm washing or any of the sperm technology that needs to be used. It doesn't cover any embryo freezing or testing or anything like that. So we do have a great funding option, but it's not limitless in terms of what it does fund. So a couple of suggestions that I would have around there is review your benefits, your workplace benefits and your partner's workplace benefits. In the past, if you've decided that you don't need to both have benefits because only one of you really, one of you has the better benefit plan, it is actually worthwhile to look into both your benefits plans during the next couple of years to see, can you both be on them and can you use each other as copay? Because once your benefits are up, can you use your partner's benefits? Most employers actually don't have funding for fertility benefits. And if they do have drug coverage, it usually maxes at $32,000. Sorry, $3,200, $32,000 would be like amazing. So if it, that is something to consider is, can you double up? And so during the benefit enrollment period, it really is important to look at that fertility funding piece. And then of course, once you finish your fertility treatments and once you're happy with the size of your family, you can go back and you can decide again, is this the right package for you? It's also, for a same-sex female couple, this is even more important. If both of you are going to go through a fertility process at one point and you want to have maybe a couple babies, it's really important to make sure that you're doubling up on this benefit package. There's also organizations that will provide you funding. As Alex mentioned in the intro, free loan. So the Jewish community does have a free loan program, which is wonderful. It's interest-free. And it covers up to $10,000 of fertility treatments. Small Wonders is another Jewish organization that you may qualify for funding for. And I also think it's important to speak with your clinic about your finances. They may be able to provide you with a payment plan or some other type of option that you may not have thought about. And one other thing is, I know that most people do tend to be a little bit shy about their fertility journey and don't want to tell their family what they're going through. Most parents who are passing on an inheritance want to pass it on to their children and their grandchildren. And so if you are in a fortunate enough position where you do think that that might be an option, I personally feel that your parents would rather see their grandchildren alive and be able to play with them and see them. So just, I think that's another reason why it's important to be open and honest with what you're going through.
Thank you for that perspective. So on the topic of families and support, Amira, can you speak a bit more about the role that a family member could play in supporting a loved one going through this journey?
Yeah, I think just giving them a hug, just listening to them, sometimes it's not offering so much advice, but just really listening and telling them that you're there for them and that you support them and that they'll get through this, and that you ask them what you can do for them. What would be helpful? How can I make you feel better? Let's talk about it.
Mhm. Yeah, just being there and listening. I love that. Just asking what, not offering advice, but just asking what you can do.
Yeah.
Yeah. And on the flip side of that, how would you offer to people to deal with any jealousy that's coming up? Maybe their friends are all getting pregnant, they're seeing baby pictures on Instagram. How do you deal with that jealousy? How do you deal with the nagging parents that, you know, keep asking when you're going to have children? How do you deal with those situations?
I think it's really healthy to set boundaries. And sometimes I have to help clients set those boundaries because they may not necessarily feel comfortable. But those feelings like jealousy and feeling, you know, that you're not living up to what you're supposed to be doing, they're really strong emotions. And I think also just bringing acceptance to them and not judging yourself for having those feelings. That can be helpful because that's something that's in our control. So just knowing it's very normal that anyone dealing with this has those feelings, normalizing it.
Yeah, thank you. Dr. Librach, I'm wondering if you can speak to egg freezing. I'm wondering if there's an age you'd recommend for egg freezing. Is this something, I know it's becoming a bit more popular for younger women to have egg freezing parties and to sort of look at it as sort of a safety net of some sort and doing it when they're younger. Is that something you'd recommend? And so maybe speak about the process and also the unfreezing process and how that looks on the other side.
Well, you know, I always say I'm amazed at the things that we can do now that I couldn't do when I first started in practice. I hate to say almost 30 years ago, because freezing of eggs is really a technology that's very new, because when we did it in the past, it was very poor. We couldn't get a very good recovery of eggs. Now we use a technique called vitrification, which is a rapid freezing, cooling, and it freezes the eggs into sort of a glass-like state, and the thawing rate is incredible with that. It's not as good as with embryos. Embryos do cryopreserve a bit better than eggs do, but it's still pretty amazing. So it's really now become, in the last, you know, several years, an important method to preserve your fertility, especially for single women who are not yet with a partner and they want to have a child in the future, and they, you know, they may meet that person, the person they want to spend the rest of their life with, and have children with later in life when their eggs may not be good enough to help them have a child. So it's a really amazing new technology we have for those women. We call it social egg freezing, and we've written a number of articles on that and research that we do on that area. And also, of course, cancer patients, before they undergo chemotherapy or radiation or surgery, can now freeze their eggs if they're not with a partner. They could, obviously, if they have a partner, they can freeze embryos, but they can freeze their eggs prior to undergoing that treatment. So later on, after they have finished their treatment, they can then have children. And the younger you are, the better it is to, when you're doing sort of social egg freezing, you have a choice, because your egg quality and quantity will be better. And I mentioned that test, AMH, anti-Müllerian hormone. It's a really good test for the number of eggs you have. And we actually developed an app. It's a free app on Apple or Android called Freeze My Eggs, and it's FRZMYEGGS. So you can download it if you are thinking about freezing your eggs, and it gives you some good tips on it. It also can do a calculator of what your chances are with freezing eggs and how many eggs you're likely to make and how many you really need to be able to create a baby. So somebody who downloads that may be a useful resource. And as I said, it's free. So the other thing is that when should you freeze your eggs? Well, if you're thinking about it, like sometime in your mid to late 30s would be a good time if you haven't got a partner yet to consider it. And, you know, some people ask, how long can you freeze your eggs for? How long are they good for? Well, it's actually been estimated you can keep eggs or embryos frozen up to 10,000 years. I don't think anyone's going to find that out yet, but there really is no limit. You can keep them forever as long as you pay the storage. That'd be a lot of storage fee, but there's no limit how long you can keep them. And we actually had a healthy pregnancy from embryos that were stored for over 15 years recently. So there really is no limit.
That's amazing. I will note to everyone as well that all the resources that are being discussed tonight will be shared in a follow-up email, so the app and all of the places that Meredith mentioned as well. So we'll make sure that you get all that information afterwards. Meredith, I've maybe a big question, and you've touched on this a little bit, but how do you budget for the unknown? If I know that I'm struggling and I'm looking at my bank account and I'm trying to figure out, you know, what do I need? What's your best advice?
Yeah, so I think that's like everything to do with fertility and life. That's a tough question, but I would say I think it's important to figure out, where are you today? So if you don't know your starting point, I don't really know how you can get to your ending point. So I would really recommend that you look at your spending for the next couple months if you haven't done it already. There's lots of apps and programs that can do it, or like really you can do it on a simple pen and paper. Think about what do you spend? What do you need? Where can you cut back? Like that, if you don't have your $5 latte a day, you're going to save $3,600 a year. That's, in my opinion, I think that's pretty substantial. So can you cut back? Can you shift it to a misto if you really need something? So just like, how can you make little tweaks? Because those little tweaks will add up quite a bit. And I think it's really important to think about, realistically, how much can you afford? And with your partner, do you have a stopping point? Is there a point at which you're not comfortable spending anymore? Like construction, I think when we plan for families, we have to plan for the unexpected, because there's always going to be those unexpected costs. You know, you peel back the onion and there's something else. You peel back the onion again, there's something else. So definitely, it's true. It is, there are unexpected costs. If your clinic isn't local, so if you don't live near your clinic, you're going to have to start planning for things like transportation, lodging, gas, those kind of things. If it's possible, I would recommend that you pre-qualify for a loan from your financial institution. It's always easier to do it now than it is later on. And also with interest rates being so low, it is something to consider. I would say, obviously, you don't want to go into debt for this, or too much debt. So definitely only bite off what you feel comfortable chewing. You know, and do you have funds saved for a rainy day? That's something to consider. Can you use the funds in your TFSA for something like this? I definitely wouldn't recommend dipping into your RRSP if you don't have to. But if you've already been saving up and you do have funds in your TFSA, is this something that you want to start taking out the money for? This is going to sound silly, but if you have a credit card, consider using your credit card for this. If you have a card that has great points, you're going to be incurring costs for medication and fertility treatments. So can you put these on your card? With that being said, I wouldn't recommend doing that if you can't pay off the balance every month. So any points that you're going to earn are going to be substantially less than the cost it's going to be to carry on debt on your credit card. So only do that if you have the funds available. You know, and I think the other thing I talked about before was workplace. What kind of benefits are available for you in your workplace, and can you double up? It may seem like you're going to be paying a lot more than you were, but I probably am going to guess that the cost of your benefits are less than $3,250 that you might get in extra funding for medication. So it is something to think about. Just make sure that you have a rainy day fund. And really, everybody's situation is so different that it's really hard to put it into one bucket, but I would definitely just, you know, think about those things. Where can you cut back a little bit? And then the other thing too is, if you're successful, and I truly hope you are successful, keep cutting back on other things because the cost of a baby is really expensive. But it's definitely, it's a good process to go through. And if you haven't gone through the budgeting process before, it's a great exercise in what do you need? And especially now that we've been in COVID for, I hate to say, it's almost a year now. What are you going without that you truly don't need?
I just want to add something about government funding that Meredith outlined so well. Just one thing I don't think you mentioned is that you're only funded up to the age of your 43rd birthday. It's actually the month of your 43rd birthday. So if you get registered before that, then you will be funded, even if things take longer to get going. So it's really important that if you are approaching that age, to get on the list and be registered for funding. The other thing is, even if you have a surrogate, they must be also, interestingly, less than 43. And you have to have your surrogate in place in order to create embryos and do the whole process. There's a lot of little nuances that are really important. And if you go to the website on the Ontario Fertility Program, you can learn about some of these details that we don't have time to talk about every one of them here, but there's some really important issues that you need to know about with the funding so you can take full advantage of it. Also, people have lines of credit. I think you mentioned that in the bank. We do have a couple of companies that will loan money, kind of like for people that use like other medical services like plastic surgery and other things like that. So but they do have high interest rates. So if you have a line of credit, you're much better off doing that.
Thank you. That's also helpful. And I wish funding existed 10 years ago. I don't, so it hasn't really even been that long, right? It's only been a few years. So it's really such an amazing win, I think, for the fertility community that this exists. Amira, I'm wondering, as someone who's gone through it myself, I know how difficult a struggle can be on a relationship. I'm wondering if you can give some tips for couples, how they can work together during this time to not get so consumed, perhaps especially when we're living in a space with our others, and in this time it's obviously exacerbated.
I think it takes a little bit more effort nowadays, but really planning a date night so that you spend time together for sure one night a week, and you try to make it special, and you try to talk outside of the fertility stuff. So that's still important to talk about and to plan, but you also need to focus on your relationship, and it would be healthy to be intimate outside of the fertile window. So this will take more effort when you're going through the journey because it's difficult and you're dealing with all the emotions. Sometimes connecting to other couples who are going through it as well in a support group can be really helpful. Speaking to a counselor.
Speaking to your rabbi, if you're, your clergy, that's an amazing thing to do for a lot of couples. It gives them comfort, I think.
I don't know if it's still run, but Amira and some of her colleagues used to run a workshop that was just for an evening for couples, and it was so helpful. My husband and I attended with some other people who were also going through it, and just the resources that were given out that night and the things that were talked about. There was a pastor, there was a therapist, there was Amira, and a sex therapist as well, and just the things that they talked about and the tips that they gave for couples who are going through it, but also how to just gain that little bit of spark back into their relationship was so helpful.
And there's also support groups you can join for single women that are having children, for people that have endometriosis, all these different support groups, and these are all resources that you can tap into.
And how would you recommend someone reaching out to these and finding the right support group for them?
There's a lot of different stuff online. Some of the clinics have a support group affiliated with them. there's a ton. I feel now with COVID, there's so many different things you can access for couples and for women, and just a variety of resources out there.
Mhm. I think we can agree that having that support and someone to talk to about what you're going through is really important, and certainly was an important part of my healing as well.
Maybe we could put together a list of some of these support groups for people afterwards so they can access them.
Absolutely, I'm sure that can be added to the resource that we're sharing as well. Thank you so much for all your questions. We will hope to get to as many as we can. As the time is wrapping up, I'm wondering, I'd love to hear what your best piece of advice is. The journey is such a steep learning curve. We're often, taught how not to get pregnant, but rarely are we ever taught how to get pregnant. So when we find ourselves on this, there's a lot of things that we learn. I'm wondering if you could share sort of your best piece of advice for anybody on any stage, your best tips and secrets. Meredith, do you want to go first?
Wow. I mean, I'm getting goosebumps actually. Like the two of my most trusted people, in addition to my husband and my parents. I'm a panelist with Amira and Dr. Librach, who really were my two trusted people. I think it's so important to have these trusted individuals. I joined Amira's mindfulness fertility group, and through that group, I was able to meet a couple of girls who I'm still friends with today. And, the ability to openly discuss my struggles, but also to be able to celebrate that early pregnancy with them was so incredible. And I couldn't do it without them. And, I think you really have to have faith and trust in your doctor. That's first and foremost. If you're not comfortable with your doctor, then I think that you need to find another doctor. I'm grateful with the support that I had from Dr. Librach and the entire team at Create. When Dr. Librach told me that we should try with one of my 2 embryos, I had 2 embryos, and Dr. Librach said, well, we got to give one of them a try. If I didn't trust Dr. Librach, then, you can't do that. You need to be able to have trust in your support system and your people. And it's so important. And thankfully, almost 4 years to the date of my transfer, I have a 3-nager. And I couldn't do it without my trusted people.
Awesome. Amira?
My advice would be to be gentle with yourself and to recognize that you're not alone, and to seek support if you need it. And maybe one day you'll be able to share your story like we are, and it will inspire others, right? So hang in there.
Thank you. Dr. Librach?
Sure. So I think one of the things, unfortunately, I see every day is people saying, I wish I knew what I knew now, that I wish I had started earlier in my journey than, waiting for my career and all the things that are going on in my life to be able to start. So I thought, I'm going to start trying to get pregnant and it'll happen right away. And the longer you wait, unfortunately, the more chance that's not going to happen, and you're going to need this help. So if you have a choice, and obviously you have to be in a good relationship with someone that you want to spend the rest of your life with and have a child with. If you're in that situation, you have a choice between doing it now versus later. Do it now, because you may regret waiting too long, and you can't turn back the clock. It's the biological clock is a reality, and it really is ticking. So you really want to start trying as early as you possibly can. So don't delay. That's if you have a choice.
And what's the best way for somebody to get referred to a fertility clinic?
So you can either go through your family doctor or your obstetrician gynecologist if you have one. Any referral, it could be an endocrinologist or even a doctor that is looking after you for a medical problem, they can also refer you. So and genetics people, there's so many different resources depending on your own specific situation. If you're in the LGBTQ community, then obviously then we can help in those situations, and any doctor can make a referral for you.
Perfect, thank you. I have a question about speaking to your boss when you're going through IVF, so they understand all your early mornings, taking off time for treatment, etc. Meredith, I'm wondering if you can speak to that question, please.
Can you, yeah, okay, so everybody's unfrozen again. This is actually something that I've become quite passionate about, and I'm trying to speak to workplaces about is, this is no different really than an employee having to go to other types of treatment. It's just that there's stigma around this. So I think that if you are comfortable enough speaking to your employer, to your boss, I think you should. I think also you don't have to give a specific. You can say, I have a medical appointment and I need to, take time off for this. The other thing is, if you're like overly uncomfortable with that, you may also be able to get a note from a doctor explaining that you need to be off. Like I needed to be on a little bit of leave, and I was able to get a note from one of the doctors. And it's important to note also, just in case you're really trying to keep this not to your employer, is that the note didn't come on letterhead from a fertility clinic. It came from their professional professor letterhead also. So if you are trying to keep it on the DL, it is possible. But I think, to my point about being open and honest, I do think that if you are open and honest, if that's something that you're comfortable with, your employer will understand as well.
Thank you. Yeah, that's helpful.
We are always happy to give notes for being off during treatments, even a break for emotional purposes, whatever it is that you need to be off. We're happy to always give a note for that. I'm sure most of the fertility doctors will do that.
Right. A question, Dr. Librach, I'm wondering if you can answer about how taking birth control affects fertility.
Birth control pills, you mean?
I believe that's what they mean.
Yeah, probably they asked. So really, it doesn't. In fact, for some cases, it may actually help, because if you have a condition called endometriosis, it can actually quiet down the endometriosis while you're taking them. There are some people who stop the pill and delay their ovulation gets delayed, and that's something we can pretty easily help them with. So the birth control pill doesn't really affect your fertility in general for the long term.
I think it's always sort of, I guess, maybe a joke in the fertility community about having to take birth control pills leading up to transfers, taking birth control pills to get pregnant. Great. So I've got another question.
If you want to, oh, sorry, I was going to
please.
About COVID. I think we need to put that in there somewhere, because
excellent. I was just going to ask that question. Perfect. So do you want to speak to the COVID vaccine and what research has been done?
Sure. I get this question every day, so I think it's good to do it on this panel, because everyone that's going through fertility treatment or has infertility wants to know these questions. So first of all, does the virus itself, if you get it, affect your fertility? And actually, there's good news there. It doesn't seem to, except there is maybe some slight effect in men if they get a very severe case of it. There may be an effect there on their sperm and their testes, but we're not 100% sure on that. During pregnancy, it seems to be, most people that are pregnant are fairly young and healthy, luckily, and so it doesn't seem to have a major effect. But if you do have things like diabetes or high blood pressure, then getting COVID would be a more significant risk to you. Now, in terms of vaccine, which I highly advocate, you should get the vaccine if you can get it anytime you can. While you're trying to get pregnant, while you're breastfeeding. This vaccine is not a live virus vaccine, and all the other vaccines of this type have not had any problems for all of those situations. It's called messenger RNA vaccine, and it's very, very safe for those people. And everyone, although they didn't do all the studies on it, there are many vaccines of this type, and they're all seem to be safe. So I would, all the fertility organizations are advocating, and pregnancy organizations are advocating, get the vaccine if you can.
Great. So I see there's a lot of questions still coming through the chat. And at this time, I'll ask just, I guess, a wrap up. And we will be concluding the formal portion of tonight's session at 9 o'clock, after which our panelists have generously offered to agree to stay on for another few minutes to answer some additional questions. So you can feel free to stay on after we conclude the formal portion. Last question around surrogacy for Dr. Librach. What does help to increase chances of successful implantation? I've heard some sources suggest avoiding exercise, avoiding stairs, avoiding caffeine ahead of transfer. So maybe you could talk to what you do recommend.
Are you talking about transferring to yourself or to surrogate? I didn't understand the question.
I think talked in general, but
In general.
maybe for themselves.
Yeah, so for yourself or the surrogate would be similar, it's the same idea. So basically, you know, to improve your chances, there are many different things that we can do. Just in terms of generally speaking, if you can reduce your stress level, that's always a good thing. I think your reproductive system works better when you're not under huge stress. So there are many things you can do, like massage, yoga, meditation, exercise, even acupuncture. If you find, I don't like having needles stuck into me, so I don't like acupuncture myself. It makes me stressed. But some people, for some reason, enjoy that and makes them relax. So if you like acupuncture, go for it. But there are these kinds of modalities you can do to try to, you know, obviously acupuncture or these things are not going to make your fallopian tubes unblock, or maybe your sperm count go up. But I think these are things that can help in terms of yourself if you're having a transfer. And then there are other adjuvant treatments that can be used to enhance transfers when they're not being successful. I don't think we have time to go through the entire area of recurrent implantation failure or pregnancy losses, but there are a lot of things that your doctor could offer to you. Sometimes, though, it's just not working no matter what we try, and sometimes we do have to go towards the option of a surrogate.
Amira, we just have a minute left of the formal portion. Do maybe you want to offer perhaps a helpful technique or tool to leave people with to help them feel better, feel less stressed?
Yeah, I think that's good. Reducing your stress is really important. So finding ways to reduce your stress, and Dr. Librach talked about massage or acupuncture. Yoga is really good. There's like fertility yoga where you can focus on certain poses that help you to relax your mind and body and make yourself feel more grounded and calm. There's Reiki, which I know you do. There's hypnosis, which can work with our subconscious mind. Just listening to guided meditation can be helpful to calm yourself.
It sounds like there's obviously so many options, and choosing the one that speaks to you and feels, if you don't like needles, acupuncture is not for you, but finding what does work for you and what speaks to you is really important.
I think for husbands, they're a big part of this, and they need to really, really support their wives. They're going through a huge amount of, you know, physical and emotional and hormones and all that. And, you know, you have to, you know, just like when your wife's pregnant, often she can be a little bit more emotional. I have personal experience with that. So, but basically, you know, I think that, you know, being supportive to your wife is very, very important in this situation.
Yes, thank you. Well, once again, I'd like to thank our panelists, Dr. Clifford Librach, Meredith Mednick, and Amira Posner. We are really incredibly grateful for your time and for sharing all your knowledge with us this evening. If you have any more questions about tonight's content, please email Rachel Wolfson. Her email, rwolfson@ujafed.org, is now up, and we'll make sure that those get directed to the right person. And so this brings us to the formal end of our program tonight. Thank you so much for joining us in the audience tonight. We hope to have more of these conversations. And as I mentioned, feel free to hop off, and please feel free to stick around and we can continue the conversation. Okay, so anybody has any more questions, again, you can feel free to post them in the Q&A and I will try and get to them. So a lot of questions coming in about surrogacy. How does surrogacy affect the DNA of the baby when the fertilized embryo comes from the couple who are seeking a surrogate? Dr. Librach, that one's for you.
The genetics of the baby comes from the parents, so the people who provided the eggs and sperm. So the surrogate really doesn't have an influence on the baby's outcome. So you can be assured that it's really going to be your own child, or if you provided the gametes. And I think that that's really reassuring. Obviously, she's has to do things during the pregnancy to make sure it is a safe pregnancy for the baby, like eating good foods and taking vitamins and avoiding any kind of toxins that the baby might be exposed to. But it is the genetics comes from the parents of the people who provide sperm and eggs.
Great. And is surrogacy available to everyone other than cost being a barrier, specifically for people in heterosexual relationships who on the surface don't have visible medical needs that would require it? So is this an open option to everybody?
So I need to understand more the question, because obviously we don't just do surrogacy just because someone doesn't want stretch marks or whatever. We want to do it because there's a medical need for it. Obviously, people that are same-sex male couples, they have no choice, or single men. But in terms of heterosexual couples or single women who need surrogacy, generally there's got to be a very important reason for it, and it could be a psychological reason. That's possible, but mainly it's because there's some physical reason that's requiring surrogacy.
And would that be at the discretion of the fertility clinic to make those assessments?
Yeah, I think it would be. Look, it could also be the fact that you're older and the risk to you is higher. If you're 50 years old and you're requiring a surrogate, you could require a surrogate just because of your own health. You want to be healthy to look after that child afterwards. So that could be an example of a real physical reason or medical reason for it.
Mm-hmm. And how long should you work with the surrogate if you aren't having luck with the embryo transfers? I'm wondering if they mean if the surrogate isn't successful.
Yeah, so generally speaking, the legal contracts which are required for surrogacy will usually do 3 transfers, include 3 transfers. And then after that, basically, depends on the advice of your doctor and as to why it may not be working. It could be related to the embryos themselves. That's why we do always prefer doing genetically tested normal embryos into surrogates, because the surrogate doesn't want to go through failures or miscarriages or having an abnormal baby growing inside them. So we want to avoid all of those kinds of scenarios when we do surrogacy. So having genetically tested embryos is really a good idea if it's possible. So basically, after about 3 transfers, generally speaking, we start to think about maybe having a different surrogate in those those situations. But there are a number of things we can do to investigate why it's not working. It could be the surrogate herself. Generally, surrogates already have children. They've had no trouble giving birth. But sometimes for some unknown reason, it just doesn't work with that surrogate.
Right. And does CREATE recommend or insist that intended parents and surrogates get independent legal advice? And then they have to have a contract, I suppose. Is that part of what a fertility clinic would provide, or is there some legal counsel that's needed as well?
So all surrogacy arrangements must have that's a policy of our clinic. I'm sure almost every clinic would have that.
Mhm.
They must have independent legal advice. So there's a lawyer that acts for the parents, intended parents, and there's a lawyer that acts for the surrogate. And that's something that is required in our clinic. And there are many great fertility lawyers in Canada. You can Google it, or you can, the agency that you may have gotten your surrogate with, if you did go through an agency, can recommend some amazing lawyers that do this. And so I shouldn't be any problem finding lawyers to help in a surrogacy arrangement.
Great. So switching gears a little bit, what goes into this decision between choosing between IUI or IVF? Someone who's had recurrent miscarriages, is one more beneficial than the other? And how would someone decide between those two procedures?
Do you want me to answer a little bit of
Go ahead.
that?
Yeah.
Please, yeah.
So, I mean, that was my situation. I had recurrent miscarriages, and for us, what we did was we went through multiple genetic testing of both my husband and I, which is where we found out that we were both carriers of a genetic disease, which then meant that for us, the safest option, because I didn't want to go through another, I wanted to reduce the risk of another miscarriage if possible. I couldn't, it was too challenging on me, was to make sure that we had embryos that could be as quote unquote normal as possible. And so we went through PGD and PGS, and really the only way to do that is—
Do you want to say what those are? Or?
Sorry, pre-genetic screening and pre-genetic
Implantation, genetic diagnosis.
Implantation diagnosis. And so one of them looks for this specific chromosomal issues, and the other one looks for various chromosomal issues. And so for us, we needed to look for both. And in order to do that, at that time, it did need to be the embryos specifically. And so therefore, because it had to be the embryos specifically, at that point, your option is only IVF. So I think it's situation specific. I would say, obviously, it's probably easier to start with IUI if possible and then move to IVF, but also it's personal.
Yeah, I think that's a great synopsis. I think that it depends on the exact situation. Every situation is unique. If you're older, obviously you want to probably move towards things like IVF faster because they're more successful and your chances are lower with IUI overall. If you're 28 years old, when you're younger, obviously you have time to spare and you may be able to get pregnant with a less invasive type of treatment and less expensive too. So I think every case is unique. Sperm counts are critical. For very, very low sperm counts are just not very successful with IUI versus IVF, which has a much, much higher success rate in that situation. And I could go on and on with different scenarios, but I think the key is that your doctor needs to, look at every situation uniquely, and you as a couple, or a single person, what's best for you? And I think speaking to your doctor is really, really important on that.
Mm-hmm. Can you talk about women on immune suppressing drugs and that effect on fertility?
So it's really the reason why you have to be on those immune suppressing drugs, because if you have an immune problem, that could affect your chances of being able to carry and may cause recurrent pregnancy losses. So I think each case, again, would be unique, as we said many times tonight. But immune suppressing drugs in themselves are not going to necessarily, depending on the specific ones, because some could affect the baby and they wouldn't be safe to use during a pregnancy. An example would be someone who's on methotrexate and for rheumatoid arthritis, that would not be safe for pregnancy, and you would not be able to be that and carry a baby. So I think each case is unique. And I think, again, talking to your doctor and your doctor that is providing the immune suppressing drugs would be very, very important in that situation.
Great. Because it's in the news, I'm just wondering, there's been a certain celebrity that's come out and says she wants to have a boy and a girl, and so she's going to go through IVF to make her family. I'm wondering if anyone wants to speak on their thoughts on that, and sort of having IVF be sort of a designer procedure where you can cherry pick your children. Amira, do you have any thoughts?
Yeah, I find it really interesting, and I don't know how much I like it. You know, I feel like there's a science in it, there's a magic in it, there's nature, and they mix together, and I don't think that you should be able to, I guess, choose those things. And I know here in Canada it's illegal. So I mean, if that's what she wants to do, great.
Yeah,
Meredith?
and to echo what Amira said, was that, like, for us, that was something that we weren't allowed to find out, right? Like, just because we had our embryos tested didn't mean that we were going to find out whether they were boys, girls, whatnot. And I think that that's actually a great policy in Canada, is that it's unknown, and the fertility community does a great job of keeping that. And even, you know, when you're in the hospital and they're doing their ultrasounds, or when you're at the clinic and they're doing their ultrasounds, if you don't want to know, they're not going to tell you. And I think that we're actually really fortunate to have that as an option. And also, I mean, I'll just say, this wasn't I guess this wasn't really your question, but having gone through everything that you go through with infertility treatments, and you know, I'm ovulating on this day, there's no surprise, I had my transfer on January 26, 2017 at this time, and all of that. Yes, I still know the day and the time. It's really nice that you have that element of surprise. There is one thing that is a surprise, and that element of surprise is just incredible.
Yeah, so as those are great answers, and really it is illegal in Canada. We're not allowed. I'm not planning to go to jail and to do that. And basically, I don't know the gender of an embryo. Our genetics lab knows, because they have it in under lock and key, password protected. So I'm not allowed to know what the gender is. There are specific situations where there's a genetic condition that may say, for example, Duchenne's muscular dystrophy would be, more in males, not in females. And so there's examples of genetic conditions, but that would be the only exception. Really, we're not allowed to choose gender. And I think, as Meredith and Amira said, I don't think it's a good idea. And it goes down a slippery slope. And there are many countries, unfortunately, where gender selection is being done, and it's creating a huge problem for society in those countries. And unfortunately, a lot of times it's trying to have a male, and then the female population is much diminished in those countries. So I think it's really important that, I think it's good for us to have that law. The only area where I think it's a little more controversial, where maybe people might sort of see the pathway, would be if you want to do family balancing. So if you have 4 boys and you want a girl, or 4 girls and you want a boy, you can kind of see that one where the ethics may be reasonable, but it's still not allowed in Canada, because I think they're just worried about the slippery slope.
Mm-hmm. Okay, so I think I will. The next question, which I think is going to be our last question because it's 9:15, is if you can just generally discuss the process of implantation and and how that would look, maybe just quickly for IUI versus IVF.
So implantation is really putting an embryo inside the uterus, it'll implant naturally. With IUI, you're just placing sperm in the uterus and has to find the egg and fertilize it, and the embryo then travels down the fallopian tubes and implants in the uterus. With IVF, we actually place the embryo in the uterus. It's done under ultrasound guidance, and we are able to place it in a location that's ideal for implantation. So, and there are things we can do to enhance implantation, like there are things like what's called, something funny that's called embryo glue, but it's actually a material that helps it stick to the wall of the uterus, and we've actually seen increased pregnancy rates with that. There are things we can do that may enhance the embryo to grow, like there's something called an HCG wash, and there's new data that shows that may help. So there's a number of things that we may be able to do to enhance implantation.
The technology is amazing, and every day there's something new. And so that ends our after party. And, you know, technology is so amazing. Dr. Librach and your colleagues are so amazing. I hope that for anyone watching this, that this has given you hope. We didn't plan it this way, but Dr. Librach was all three of our fertility doctors, and is responsible for all of our children. So thank you, Dr. Librach. And you know, I really hope that anyone out there can find some hope and find the information that you need. And if you have any other questions, please feel free to reach out to Rachel. And thank you so much for joining us tonight.
I want to thank our moderator, Alexandra. You did a fantastic job. Thank you. It was really a great event. And
Thank you.
maybe we'll do this again sometime. That's great. Thank you.
That's great. Thank you so much, everyone.